Today our topic is childhood injuries. Here we're going to see how to present the latest statistics regarding the childhood injuries, and we're going to discuss about the risk factors increasing the children's vulnerability to injuries, and we're going to enumerate the preventive strategies to address the childhood injuries. This is a physical damage that results when a human body is suddenly subjected to energy in amounts that exceed the threshold of the physiologic tolerance, or else the result of a lack of one or more vital elements such as oxygen, like mechanical, thermal, chemical, and the radiation. Injuries are classified into two types of unintentional and the intentional one. In case of unintentional, they are road traffic injuries, falls, drowning, aspiration, foreign body insertion, dog bites, poisoning, and burns. In case of unintentional one, they are assault, interpersonal violence, suicide, and acts of war. This comes under the unintentional one, and the above given examples are the intentional. Leading causes of the child mortality rate according to the DOH in 2001: pneumonia, accidents, diarrhea, measles, congenital anomalies. These are in the order for 1 to 4 years. Accidents, pneumonia, malignant neoplasm, diarrhea, congenital anomaly. This is the order for 5 to 9 years old people. And 10 to 14 years, accident, disease of the heart, pneumonia, malignant neoplasm, and the congenital anomalies. While almost 10 years after, the leading causes of the child mortality in 2010 according to DOH is 1 to 4 years people have the pneumonia, diarrhea, congenital anomalies, septicemia, and CNS disorder. While speaking about the 5 to 9 years age old people, they are having pneumonia, dengue, accidental drowning, CNS disorder, transport the accidents, and 10 to 14 years when they have pneumonia, accidental drowning, CNS disorder, transport accidents, and the congenital anomalies. In 2019, the leading cause of the child mortality: pneumonia, septicemia, acute respiratory failure, diarrhea, and the leukemia. Pneumonia, severe dengue, septicemia, leukemia, acute respiratory failure for 5 to 9 years old, and 10 to 14 years they have dengue, septicemia, pneumonia, acute respiratory failure, and leukemia. This is the order. So here we are seeing the epidemiological triangle. In the traditional model host, then they have agent and the environment, which is the interconnected one, while the injury model have the injured person and they have loss or gain of energy, and the physical environment and the social environment, this is the interconnected one. Most are at the risk for the foreign body aspiration, and they are at the risk of falls and cuts. For every 24 seconds someone dies on the road. 1.35 million road traffic deaths everywhere in every year. Low income countries, which have the 1% of the world's vehicles and the 13% of all death. High income countries have the 7% of death and the 40% they have the world's vehicles here. The first cause of the death among the children aged 14 and among young adults aged 15 is died by accidents, by vehicle accidents. 54% of the death and the pedestrians were cyclists and the motorcycle ones. And the road traffic injuries are the 8th leading cause of the death. Road traffic injuries among the youth in the Americas, like the road traffic fatalities are the second leading cause of the death among the youth in the America. Homicides, which is 24%, traffic fatalities, which is 20%, suicides, which is 7%. 30,000 people who is close to young person aged 15 to 24 years die each year due to the road traffic injuries. New teen drivers have up to 10 times of the crash risk of adult. 4 out of 5 of these are males. And the road traffic injuries contribute to disabilities, medical costs, future earning losses, property damage, and reduced quality of life. World Health Organization Road Safety Report in 2015, 1513 reported road traffic death. And the 10,379 people are estimated the road traffic death according to the World Health Organization. 53% by the motorcycle riders, 90% by the pedestrians, 14% by the four-wheeled vehicle drivers, 11% of the four-wheeled vehicle passengers, 2% of the cyclists, and 1% of others. Road traffic fatality, the death occurring within 13 days of the road traffic crash. Head and the limbs are the most commonly involved parts here. Severity depends on the form or the amount of the mechanical energy transfer, age of the child, type of road user like pedestrian or the riders, and the use of the protective device. Risk factors like impaired driving, distracted driving, risk taking, driving with peers, not using the seat belts, and the inexperience, speeding, and the riding without the helmet. Road traffic injuries are the preventable one. They promote the use of helmets and the seat belts. Enforce tougher driving under the influence of laws. Implement the comprehensive alcohol policies, taxes, and the community alcohol programs. Restrict the alcohol advertising aimed at the young person. Reduce the number of passengers on the motorcycles. Strengthen speed management laws and measures. Design the safer traffic environments. Incorporate the road safety in urban and the transport planning. Introduce the graduated licensing laws and the models for the new teen drivers. Improve the post-crash care for the victims of the road crashes. Child restraints. The infants are rear-facing, child's front-facing, and the older children, they have the boosted cushions or seats. Fall. Event which results in the person coming to rest inadvertently on the ground or the floor or other lower level. Most common injury of the Filipino children in the home. Lessons learned from the fall form the necessary foundation for the neuromotor development. Consequences like the traumatic brain injury, spinal cord injury, and the limb fractures. Brain injury in kids. Almost 500,000 kids are treated in an emergency department each year for the traumatic brain injury, including the concussion. That's more than 5,000 of the nation's largest school buses are filled with the capacity. Some brain injury signs and symptoms like the headache, dizziness, blurred vision, difficulty in thinking, and clarity. They don't have the clear thinking. They have sensitivity to noise and light. What to do if you think a child has a brain injury? Assess the situation. Be alert for the brain injury signs and symptoms. Contact a healthcare professional. 50% of the head brain injuries among the kids are due to falls. Social and the demographic factors like age, gender, ethnicity, and the socio-economic status. Physical development of the child. Activity taking place before the fall. Location of the fall. Height from which the fall occurs. Characteristics of the surface with which the contact is made. Anatomy of the human body. Impact the force to which the body is subjected. The greater the height, the greater the injury. The presence of special protection. Impact the observing materials in the landing or contact the surfaces. Assess to timely evaluation and management. Help keep kids safe from brain injury. Easy home modification to prevent the falls is install the handrails, improve lighting, inexpensive fixes, repair the steps and flooring, install the grab bag, use the non-slip mats and threads. Drowning, process of submersion or the immersion in the liquid medium resulting in the primary respiratory impairment that may or may not result in death. Mortality is highest among the children who is aged 1 to 14 years. Compared to other causes of injury, drowning registers the least non-fatal outcomes. The risk factors are age 6, they does not know how to swim. Flood disaster, seizure disaster, concomitant trauma, stroke, MI. And they also have the undetected primary cardiac arrhythmia. Drowning which have the hypoxemia and ischemia leads to the neuronal injury and death, and the cerebral edema and increased ICP. Irreversible brain injury if anoxic is greater more than 55 minutes. Fluid aspiration leads to the surfactant dilution, and this leads to the alveolar instability and the PQ mismatch and the hypoxemia. The worst case scenario like the pulmonary edema and ARDS. Hypoxemia and hypothermia leads to the arrhythmia. They also have the acute tubular necrosis and the renal failure. The metabolic and the respiratory acidosis can occur due to the poor perfusion and the ventilation. The key facts about the unintentional drowning is 10 people die every day from the unintentional drowning. Of these, 2 are children under the 14. Drowning ranks 5th among the leading cause of the unintentional injury death in the United States. From 2005 to 2009, there were an average of 3,533 fatal unintentional drowning annually in the United States. More than 50% of the drowning victims treated in an emergency room require the further care. Among the children ages 1 to 4, the worst drowning occur in home swimming pools. The drowning is the second most common cause of the death for this age of group. And the prevention the drowning. 10 actions to prevent the drowning is: install the barriers containing which controls the access to water. Provide safe place away from the water for the preschool children. Teach children basic swimming, water safety and the safe rescue skills. Train the people in the safe rescue and the rescue. Strengthen the public awareness and highlight the vulnerability of the children. Set and enforce the safe boating and shipping and ferry regulations. Improve the flood risk management locally and nationally. Coordinate drowning prevention efforts with the other sectors. Develop a national water safety plan. Address the priority. Research the questions with well-designed studies. Drowning is an under-recognized global public health issue. When should you see a doctor about the drowning concern is drowning is when the child has the respiratory problems caused from being underwater or being immersed in the water. This can happen after the swimming and bathing. They also have the fatigue, vomiting, coughing and the fast breathing. Extricate the victim from water, call for help, check the breathing and pulse, activate the ARS and EAD, give 2 breaths and watch for the chest rise, start the CPR. Maintain the SATs which is 94% via the NRM 11 to 15 LPM which is lesser than ET. Intubate if apneic with a poor respiratory effort, inadequate oxygenation like PO2 is lesser than 60 mmHg, inadequate ventilation like PCO2 greater than 50 mm per Hg. Maintain the SATs 94% via the NRM 11 to 15% LPM per ET. Intubate if apneic with a poor respiratory effort. Complete PE, X-ray, ECG, monitor electrolytes. Elevate the head of bed by 30 degree. Maintain the cerebral perfusion pressure. Hyperventilate if with acute rise of ECP. Duration of submersion should be greater than 5 minutes. Time before the BLS greater than 10 minutes. BLS duration is more than 15 to 25 minutes. Age is greater than 14 years. CGS must be lesser than 5. Persistent apnea and CPR and pH should be lesser than 7.1. Burns results when the integrity of the skin or other organic tissue is compromised by the thermal energy. They may include the injuries due to the radiation, radioactivity, electricity and friction of chemicals. Scalp burns, contact with the hot liquid or steam. Flame burns, direct contact with fire. Electrical burns, passage of electrical current through the body. Contact burns caused by the hot solids, usually metals. Chemical burns, exposure to the reactive chemical substance. Lungs and browdom, accurate but time consuming and cumbersome. Burn thickness. If it is a superficial burn, they affect the epidermis. They will appear as a dry, blanching erythema and they will be painful. They heal without scarring. 5 to 10 days will be taken. Superficial partial thickness. They affect the upper dermis. They have blisters, wet blanching erythema. They are painful. They heal without the scarring is lesser than 3 weeks. Deep partial thickness. Lower dermis, yellow or white, dry, non-blanching, decreased sensation. Heals in 3 to 8 weeks. Likely to scare if healing. It will take nearly more than 3 weeks. Full thickness affects the subcutaneous texture, white or the black or brown, non-blanching, decreased sensation. They heals by the contractive more than 8 weeks, but they have scars. Stop the burning. The first aid for the burns is strip hot cloth and jewelry. Turn on the cold tap. Never use the ice. Run the burn under the cool water for 10 minutes. Keep the rest of the person warm. Organize the medical assistance. Protect the burn with cling film or clean cloth. Do not use the dressing, fluffy cloth, and cream solutions. Fluid resuscitation. Packland formula. Volume of Ringer's lactate 4 ml into percentage of a BSE and weight. Half for the first 8 hours, half for next 16 hours. Target up to lesser than 30 kg, 1 cc per kg per hour. If it is more than 30 kg, greater than 0.5 cc kg per hour. Burn wound management like thermoregulation 28 to 33 degrees Celsius, nutrition, tetanus toxin, analgesics, referral to the rehabilitation medicine. Intentional injuries like immersion burns, flash burns, flexion burns, contact burns. Criteria for transfer: partial thickness burn greater than 10% of TBSA, burns involving the face, hands, feet, genitalia, perineum, or the major horns. Third degree burns in any age group, electrical burns including the lightning injury, inhalational injury, chemical burns, burn the patient with a pre-existing comorbidity, any patient with a burn and the concomitant trauma, patients admitted in the hospital without the qualified personnel or equipment, patients who will require special social, emotional, or the rehabilitative intervention. Thank you.